This week on my podcast, Get Naked with Dr. Kate, I talked with one of the clinicians on my team, Imani Reynolds, about the effect that CSA has on parents and their sexuality. This series of slides is about how CSA affects the families of survivors. In this 2017 study by Fong et al., 6 researchers performed a qualitative study to look at the impact that CSA had on 22 non-offending caregivers in Philadelphia. Interviews were audio recorded, transcribed, coded, and analyzed using modified grounded theory. What they found, and this probably won't be super surprising, is that caregivers experience significant emotional and psychological distress characterized by anger, depressed mood, guilt, and after learning that their child may have been affected by CSA. The results also identified 4 specific sources of caregiver distress. 1, concerns about their child. 2, negative beliefs about their parenting abilities. 3, family members' actions and behaviors. And 4, memories of their own past maltreatment experiences. Most of the caregivers that participated in this study believed that mental health services for themselves were necessary or beneficial to help them cope with the impact of the CSA that their child experienced. So while CSA profoundly impacts the victim and survivor's lives, it doesn't just impact their lives. It also has adverse effects on everyone in their family, even if the family members don't know about the abuse. For example, siblings or cousins. The impacts experienced by non-offending parents, and in particular mothers, as a result of their child's CSA victimization, can mirror those outcomes experienced by victims and survivors. So in other words, even if a parent has not experienced CSA or sexual assault of their own accord, they may present with symptoms that look a lot like PTSD and look a lot like the same symptoms: hypervigilance, avoidance, fear, negative cognitive beliefs about self, others, and the world that their child may be experiencing. So if you or your family have been impacted, please know that help is out there, and folks can help you as victims or survivors. They can also be available to help your families. Oftentimes, perpetrators are someone known to the victim. In fact, far more often than not, perpetrators are known to the victim. And what that means is that more often than not, the perpetrator is in the family or a neighbor or someone who has proximity to the family. And so everyone in the family benefits from getting help and getting assistance when even one victim has been identified.